Hello, everybody, and welcome to the Higher Levels with Shay show. I am so excited about this 5-part series that we are in at this time. If you missed yesterday's show, let me just give you a quick recap. So on yesterday, we went over cancer. We went over cancer as well as the risk factors of cancers. And we also gave some amazing herbal remedies in which you can take or you can encourage someone to look into as far as treating their signs and symptoms of cancer. And so that was such an amazing show. And today we're going to continue with our series. And our series is healing both physically and spiritually. In today's topic, we're going to talk about the female reproductive system, along with the issues and herbal remedies that you can incorporate into your lifestyle to eliminate the signs and symptoms and risk factors of female reproductive issues, such as fibroids, cysts, hormonal imbalance, difficult menstrual cycle, infertility, PCOS, which is polycystic ovarian syndrome, and so much more. So stay tuned because I'm going to be playing a pre-recorded educational show that I did on my other platform, and I'm so excited to be able to bring it right here to the Kingdom Purpose Television and the Kingdom Purpose Radio platform. If you are not able to watch this live, be sure to download the Kingdom Purpose Television app, and remember to follow my show, Higher Levels with Shay, where you can have on-demand access to this information. God bless you, and I hope that you enjoy the show. Hey, everybody. Welcome back to Higher Levels with Shay. I am your host, Shay. And today we are going to be discussing human reproductive system issues. And we're talking about both male and female issues. Okay, so let's jump right into it. So right here, if you look at the screen behind me, I do have these diagrams. And the diagrams are anatomies of the female reproductive system and the male reproductive system. And so we're going to talk about the vagina, the cervix, the ovaries, the uterus, the fallopian tubes. We're going to talk about the testicles, the epididymis, the uterus of the male, the prostate, and the bladder. So first off, I want to say thank y'all for joining in on this live. The way we're going to do it is first we're going to tackle issues, well, the anatomy of the female reproductive system, and then we're going to talk about like normal reproductive system occurrences, how it normally should be, and then we're going to talk about impairments and dysfunctions and signs and symptoms of abnormalities in which you should look out for. And then we're going to discuss the male reproductive system. We're going to do the same thing, talk about the anatomy and physiology of the male reproductive system. We're going to talk about disease processes with the male reproductive system, the positives and how it should normally operate, and then impairments. And then at the end, we're going to talk about herbs and natural holistic healings and ways to prevent and reverse those symptoms and reverse those disease processes. Okay. And you know what I always say, if you don't have symptoms of those disease processes that we're going to be discussing, then do you really have the disease? Okay, so we're going to jump into it, and I want y'all to save y'all questions. Of course, comment, and I want y'all to participate, but I'm going to be focusing on the text here, and then I want y'all to save y'all questions to the end. So do make sure that y'all are liking this, liking and sharing if y'all are learning anything from this knowledge that I'm giving y'all right now, okay? So for the females, the disease process, we're going to talk about PCOS, and that's polycystic ovarian syndrome. We're going to talk about infertilities. We're going to talk about menopause, and we're going to talk about dysmenorrhea. Dysmenorrhea means abnormalities of your menstrual cycle or difficulties with your menstrual cycles, okay? So we're going to talk about all of that when it comes to the females. Males, we're going to talk about erectile dysfunction. We're going to talk about infertilities. We're going to talk about BPH for men, and we're going to talk about, I think I said erectile dysfunction, did I? Oh, and we're going to talk. So, the opposite of erectile dysfunction is priapism. So, we're going to talk about priapism, which is extreme hardening of the penises, and you can't get the erection to go down. So, that is also an issue, believe it or not. And so, we're going to discuss all of that. So, first, let's talk about the female reproductive system. And I want y'all to get y'all pens and y'all papers down. I took a lot of notes because I want to make sure that I tackle everything when I'm discussing this with you all here. Again, for those who are new to my page, I am a bachelor's degree registered nurse. I've been in the medical field for over 15 years, and I'm a certified herbalist, been into herbalism for the past 3 years. So I make my own medicines, my own tinctures, I make my own creams and everything. So that is what we're going to be talking about today. And don't suggest because we started today, I know we're a little bit off schedule. We're still going to have our standard time tomorrow at 4 p.m. Central Standard Time tomorrow. And we're going to be discussing diabetes tomorrow. Could you hear me now? Oh, hello. Could you hear me? I am so sorry. Oh, no. Did you guys hear anything that I said? Or no? Did you guys hear anything that I said? Okay. So then we'll go back and we'll start this over, okay? So somebody said I heard the first part. I don't know why it went out like that then. Okay. So let's start over then. So today we're going to be discussing the reproductive system as a whole, both male and female. We're going to be covering the female reproductive system and the male reproductive system. Now, like I said, for those who are just tuning in to me, my name is Shay. This is Higher Level with Shay. We're going to do a higher level education, higher levels of lifestyle, just higher level of knowledge, okay? Today we're going to do, when we discussing the reproductive system, the way we're going to do is I'm going to discuss the anatomy of the female and male reproductive system. We're going to talk about the proper functions of it, and then we're going to talk about the dysfunctions and the impairments of it. And specifically for women, we're going to talk about like dysmenorrhea. Dysmenorrhea means difficult menstrual cycle, painful urinary cycles. We're going to be talking about polycystic ovarian syndrome. That's when you have a lot of cysts on your ovaries. We're going to talk about infertility, menopause. These are some of the things, and breast and cysts on the breast. So we're going to be talking about these things when it comes to female reproductive system. For the men, we're going to talk about erectile dysfunction. We're going to talk about priapism. Priapism for men is when you have the hardening of the penis. And that's when the penis is, and that's really, really is a problem, believe it or not. And we're going to talk about BPH for men. And we're also going to be talking about erectile dysfunction and fertility. So that's what we're going to talk when it comes to the men, okay? Now, at the end of all of this, we're going to talk about herbs. Natural healing, natural herbs that can help y'all reverse any symptoms that you're having. Now, keep in mind, like I said, I've been a nurse for over 15 years in the medical field. And the past 3 years, I'm a certified herbalist, okay? So I want y'all to like this lab. I want y'all to share this lab. Invite anybody to this lab who are having reproductive issues. If you yourself are having difficulties with your menstrual cycles or with pregnancies and men, if you're having issues with low libido, shortening of the penis, we can talk about penis enlargements, natural remedies of penis enlargements, and so forth and so forth. So I'm glad y'all are able to hear me now. Thank y'all for telling me. Sorry about the technical difficulties. But as I was saying, tomorrow, for those who know my normal schedule, sorry about that, but I will be on tomorrow at 4 p.m. Central Standard Time, in which we'll be discussing diabetes, okay? So let's go back through the chart again and we'll discuss the chart. So you have the uterus, and you have the fallopian tubes, you have the infundibulum, you have the endometrium, the vagina, the cervix, and the ovaries. So let's go into it. So the cervix is the uterine opening. That's your uterine opening. And then you have your ovaries. The ovaries is what houses obviously your eggs. That's what it's called, the eggs or the ovums. Okay. Then what the infundibulum is, what it does is it's like these finger-like stringy hairs that pulls the egg into the fallopian tube and then into the uterus in order to be fertilized. All right. Then we'll talk about the males when we get to the male part in general. Okay. So I want y'all to comment. I want y'all to ask questions if y'all have any questions about this particular, any particular topic, and I will get to them as they are when I get to the end. Okay. So thank y'all for joining the lab. So now for the parts that's not here on the screen is the mons pubis. The mons pubis is your area right above. That's your pubic area, and it's a little fatty area. And then on the mons pubis is your pubic hairs, and your pubic hairs covers your entire vagina because that's more like that's an extension of your nervous system, and so it sends signals to your brain when there is any bacteria, any viruses, any objects near the vaginal area. It will alert the brain. Then you have your labia majora and your labia minora. So your labia minora is the inside of lips of your vagina, and then the labia majora is the outer side lips of your vagina. Okay. So you also have a lot of little holes down there in your vagina. A lot of people think you only have 2 or 3 holes, and then you have your urinary hole, which is called a urethra, and the vagina. But no, you have multiple holes, and those are your secretion glands. If you really take a look at the diagram and pay attention to the vagina, it's like your secretion glands. It helps to excrete fluids to help to keep the vagina moisturized. Okay, so I just want to make sure I say that FYI. Now, what is going on with the vagina? So we have the reproductive system, and in that reproductive system we have a menstrual cycle. So what is our menstrual cycle? A menstrual cycle is typically what a woman will have every 21 to 28 days. Okay, now what's going on in the menstrual cycle is the lining of your uterus, which is the endometrium, that's your uterine wall. So the lining of your uterus begins to shed. So every single month your body wants to get pregnant. And when you do not conceive, what happens is your hormone levels, your estrogen levels increase. It lets your body know that you're not pregnant. And then, your estrogen hormones increases, and then you begin to shed the lining of that wall. So when you shed the lining of the wall, that is your menstrual cycle. Okay. Now, what is a normal menstrual cycle? We're going to talk about 2 things here: normal menstrual cycle, and we're going to talk about normal vaginal smell. And we're going to talk about normal vaginal secretions. Okay, so we're going to talk about those 3 things right now. So let's get into it. Normal vaginal secretions should be clear, like water. It should not be cloudy. It should not have an odor, and it should not be like really sticky and like pustule. Okay, so it should be clear, and it should be malodorous to no odor. Malodorous to no odor. I mean, it's like a really like you barely can even smell, or there's no odor at all. And we'll get into it as to why I say that, because a lot of people say, like, it should be a smell. There's some type of smell. If there's a smell, then that means there's toxins. And so if you're typically a woman who has an odor, then I want you to know that means that your body's letting you know that you're full of toxins. Okay. And we'll get into what causes those particular odors. Okay. Now, the next thing we're going to get into is there should be no itching or no discomfort. Your vagina should feel pleasant. You shouldn't feel any burning sensation while you're urinating. You shouldn't feel any pain during intercourse. Okay, no pain at all during intercourse. No pain at all during your menstrual cycle, and you shouldn't really have any pain at all or no discomfort at all during urination process. All right, that's one thing. The next thing I want to talk about is your normal cycle. So your normal cycle, typically women should be bleeding between anywhere from 3 to 7 days. Okay, if you're bleeding longer than that, then that is concerning. Okay, so a lot of women, typically the standard is 2 to 3 days, but I know women who bleeds maybe 5 to 6 days. Some only bleeds 1 day. All right, so you should have a cycle between 2 or 3 days. Your cycle should be red blood. You should expect small little, like tiny, very, 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 very small, like clots. That is your body shedding. You know what I'm saying? But what you shouldn't have is huge, large clots. You shouldn't have huge, large clots coming out of you during your menstrual cycle. Okay. Now, again, with your menstrual cycle, it should smell like fresh blood. It shouldn't be foul odorous. It shouldn't be a strong fishy odor. Those are not normal. For somebody in the comment asked me, am I a doctor? I am a medical specialist. I've been in the medical field 15 years, as I stated, and I'm a certified herbalist for the past 3 years. So I have an extensive healthcare career here. Thank you for tuning in to my live. I appreciate it. So for the again, those are like your normal cycles flow. It should be light. It should be easy. It shouldn't be extremely heavy. It shouldn't be super, super dark blood. That's not a good sign. And it shouldn't be extremely painful. And like I said, it shouldn't be extremely smelly either. Okay. So let's get into what should we talk about here first? Let's talk about infertility, because I was thinking about maybe doing PCOS, because that's the one I keep getting a lot of questions about. But I think I want to go and talk about let's talk about dysmenorrhea first. Now, dysmenorrhea is difficulty with your and discomfort during your menstrual cycle. So, what do y'all think are some causes of dysmenorrhea? What causes difficulties during your menstrual cycle? What do y'all think? Let me see y'all in the comments. What happened when you miss your period for a year? So now I'll tell you right now, if you haven't had a menstrual cycle and you're in, I gotta make sure I make this clear so I can answer your question. If you are in your birthing ages, you know what I mean, your reproductive ages, then absolutely you should be seeking a specialist. So if you're within your fertility ages and you missed your period for an entire year and you're not on birth control, then I highly suggest you go and see your OBGYN as quickly as possible, okay? Because that is a sign that you should be having, every woman should have a monthly cycle every single month. So good. Somebody said endometriosis, absolutely. What we eat, absolutely. Radiation, perfect. So those are some of the things. Also, some of the things that causes dysmenorrhea are hormone imbalance. What are some things that cause hormone imbalance? Birth control causes hormone imbalance. What we eat, heavy mercury, heavy metal, carcinogens causes hormone imbalance and dysmenorrhea. Smoking and drug use causes dysmenorrhea. Heavy and excessive acid buildup from, like I said, red meats and processed foods causes dysmenorrhea. What else causes? Come on, keep y'all in the comments. Somebody said a bad liver function. Good. Come on, I see y'all in the comments. Let's talk about it, because I just feel like we need to really be discussing this stuff, because at the end of the day, this is a must. Somebody asked somebody asked how many pass a day. Okay, so you should be having 40 to 80 milliliters of blood a day saturated in 1 day. So you should be having 40 to 80 mLs of blood a day. That is normal. You're welcome. You're welcome. That is a normal period flow. So that's anywhere between 3 to 5 pads a day. If you look on the back of the pad, it actually tells you that you should be changing your pad either one of these 2 times, whichever one comes first. Overly saturated, so if it's already saturated, throw it out, or after at least 6 hours. So if you're wearing it for more than 6 hours, even if it's not that saturated, then discard it and put another one on. So you should be going to at least 3 to 5 pads a day. If you're going through 8, 9, 10 pads a day, that means that is an overflow. And that is abnormal. So that is an abnormal finding. Thank you. I appreciate it. Thank you. Let me see y'all in the comments. Somebody put the shocking. Okay, so why did you put that when you said mind blown? Let's talk about it. What was it about? What's mind blowing, y'all? And I want us to get deep into it because we are family here, and I want us to be able to have these kinds of conversations. Because I realized, and I'm slowing down my lives, because in my lives, when I go back and I review them, I feel like I'm just like going and going and going. And I'm going next, then I'm going next, and then I'm going next, and I just keep going. And then I say the questions to the end. But I want y'all to start putting in y'all comments what it is y'all want me to continue. So before I go on to the next thing, do y'all have questions about the first thing? I think for me that's okay. So do y'all? It's first time here. You are absolutely informed. Thank you. Well, welcome. We welcome you. So if you go to my YouTube channels, Higher Levels with Shay, then you will find the other video. We talked about cancer. We talked about kidney function diseases and the different herbs and remedies to cure yourself of that. We talked about, we talked about so much. Yeah, we talked about kidneys, talked about all forms of cancer. We talked about ADHD and autism briefly, but I'll touch back on that. We talked about what did we discuss? There's a few videos on there. You will see it's a lot of videos on there, so that you will find on my YouTube channel. So, and today we talk about female and male reproductive issues, and then tomorrow we're going to be talking about diabetes and pancreas issues and how to heal yourself holistically of those issues. So I definitely want to get into this with y'all because I don't want anybody to, be stuck on a question and then I'm going and going and going. Coach Jesse Breakfast Club said that there should be no cramping. Oh, you should not have. And that I'm glad whoever just said that. Can you stress? Can you miss you? Absolutely. So I'm glad now. This is what I mean. That's why I'm glad I'll be pausing and giving y'all an opportunity to discuss some things or question some things. So somebody just said there was a life coach who was on a particular podcasting or radio station show, and they said that you should not. Cramping is not normal. Any form of pain in your body is not normal. Headaches aren't normal. Muscle pain isn't normal. Joint pain isn't normal. So why would menstrual cycles pain be normal? That's what dysmenorrhea is. It's painful menstruation. So there's even a diagnosis. If you have pain during your menstrual cycle, including cramping, then you have dysmenorrhea. That means you're having a painful or difficult urinary cycle, and you shouldn't be having that. Your urinary cycle should be, like I said, it should be at ease. It should be an easy flow. It should be a happy flow. Why is your body constricting and contracting so much during this cycle? Because it's trying to release too many toxins. Another reason why is dehydration. I cannot begin to tell y'all how many of my patients do not like to drink water. And your body, your muscle, especially during your menstrual cycle, you need to be as hydrated as possible during your menstrual cycle. This is what I found in my 3 years of me tapping into herbalism. And once I did my lifestyle change, let me just be very open with you all right now. Because like I said, we're family, so I can be open with you here. I never really had painful, I never had cramps. I never experienced cramps during my menstrual cycle, but what I did experience was like lower back pain. I would have like sharp lower back pain or like sharp pain in my pelvic area, like shooting down my thighs. But I never had like stomach cramps, and I couldn't stand it. I hated it. I didn't understand why I always had that. My menstrual cycle was always between like 3 to 4 days. It was never heavy. And it was like a faint odor. It's like, the regular menstrual, like dirty blood. You see what I'm saying? Like dirty blood smell. This was before when I was eating. This is when I was drinking wine all the time. I always drink water, but this is when I was drinking wine. This is when I was eating beef and pork and fast food, and I was just eating all this junk food. Then I started to do a fast. Now, what I used to do before I started my fast was I was trying to just get slim for the summer. But I noticed that when I did that and by my fast, I would eat just fruits, vegetables, and herbs. I drink water. I drink smoothies. I still ate like chicken wraps, but I let go of beef. I let go of pork. I didn't drink any alcohol. I let go of all. And then that's when I started to notice like my periods were lighter during that time. I didn't have that pain as much during that time. And it wasn't until I didn't really pay attention to my periods during those 3 months fasting. I did it, in the summer. I never really paid attention. Yeah, I never really paid attention to the transition until I went back to the meats and the processed foods and the Burger King and the Wendy's. And when I started going back to those, and the cramping and stuff started coming back, I'm like, why is all of a sudden this is starting to, and then the next year after that, I would do it again. Always trying to look cute, slim during the summer. Let me do my fast again. And then I said, wait a minute. I realized that during the summer, when I'm on this fast, I don't have my those pains in my back aren't there. My period is 2 days max. It's little to no odor. Like, I just started just paying attention. This was before I even started tapping into herbalism 3 years ago. Honestly, this started in like 2019. I started tapping into herbalism in 2021. So in 2019, I started really paying attention. And then in 2020, I started really connecting the dots. I'm like, it's the food. It's my lifestyle. This isn't normal, right? And now as a nurse, I know it wasn't normal. As a nurse, you tell the patients over and over again. But even as nurses, and I have to admit, we don't always live the life that we push our patients to do. Like, don't eat this, don't eat that, don't eat this. But then we working so diligently 12-hour days, we stop at McDonald's, we're stopping at the Wendy's. So that's true transparency. I'm telling you what to do, but then I'm not living my education. So I started to do that. I said, let me practice what I preach. You see what I mean? Let me practice what I preach. And then because now I'm starting to notice that, because when you're young, you think that, nothing can touch you. You feel untouchable. You feel like, oh, that's this 56-year-old patient, this 70-year-old patient, this 40-something-year-old patient. I'm still young, and 40s is disclosed, that's still young. I'm not saying it's not. I'm just saying at the time, and my thought process, when I wasn't living what I was preaching, it was because I wasn't having any symptoms. I wasn't having any abnormalities. So you think in your brain that you're untouchable until you start being touched. And you're like, this is starting to hurt. This isn't feeling well. So I began to start to do exactly what I'm teaching everyone to do. And that's when I noticed the difference. So stress causes dysmenorrhea. Stress causes heavy menstrual flow, or it can stop your menstrual. So for the person who asked that question, what if you haven't had your menstrual in a year? That I will have to ask, yeah, you're a young buck. Somebody say, I'm young and I'm 46. Yeah, you're young. Listen, you are young. And the actual age that we consider elder in the medical field is 75 and older. So if you're 74 and younger, you're still young. Okay. So stress can cause dysmenorrhea. Stress can cause you to even have heavy flows or no flow at all, because it's all about your hormone imbalance and how it affects you as an individual. And stress, any type of stress. And what I want to say is these disease processes that we're going through, it has no age. Anyone can be affected at any age. It has no age. Okay. Any questions? Wrong processed foods causes dysmenorrhea. Eating meats causes dysmenorrhea. Alcoholism causes dysmenorrhea. And I'm going to tell y'all right, Frank, your pH balance being off causes dysmenorrhea. What throws off your pH balance? Hormone, contraceptives, can throw your pH balance. Having multiple sexual partners can throw off your pH balance, because you got to remember, our body we have an acid-base balance in our body. So if you are more acidic in your body, then you're gonna have you have more toxins in your body. Then your body, your menstrual cycle is a detox mechanism monthly. So if you're having difficulties during your menstrual cycle, then that means you're full of toxins. So with the pH in the vagina, your vagina is a bit more acidic than the rest of your body, because it is there to kill bacteria and the bacteria and germs that inserts into it. If you are having multiple sexual partners, understand, male or female. Listen, male or female, you can give yourself an infection. You see what I'm saying? You can give yourself an infection, and that can be the very cause. Yes, somebody who has who isn't properly cleaning themselves, don't have proper hygiene, can cause you to have difficulties with your menstrual cycle. Absolutely. We're going to get into some herbs on how to not only prevent dysmenorrhea, but to cure yourself the signs and symptoms of dysmenorrhea, meaning you're going to have lighter menstrual cycles, you're going to have regular menstrual cycles, you're going to have painless menstrual cycles, and malodorous to no odor menstrual cycles. All right. So before we get into what are we talking about? Somebody, I'm going to do endometriosis, or should I do polycystic ovarian syndrome? Let me see here. Because I don't want to, I'm going to say menopause. Somebody in the comments said menopause, but I want to say menopause for last. Okay. So you know what I'll do? I'll go into the polycystic ovarian syndrome. Let's do polycystic ovarian syndrome. And the reason why I want to do that one is because, oh, see, I didn't know that. Somebody said Kiki Palmer has polycystic ovarian syndrome. It's very, very common. Actually, it's a lot more common than a lot of us think. Now, I'll tell you what I'm not going to be covering on here. I'm not going to be covering cancer, because that's in my, I cover breast cancer and uterine cancer and ovarian cancer in my cancer live that is on my YouTube channel. And so on my YouTube channel, Higher Levels with Shay, y'all can go follow and subscribe to that one, and then look at the one that says cancer cures. Then you'll find that one. Okay. So endometriosis is first of all, endometrium is the lining of your uterine wall. And so endometriosis is when it's found, your uterine wall is found on the outside of your uterus. Okay. So that's endometriosis, or it is found like bulging in the, between, so you have an anal, you have a wall in between your anus and your vagina, right? And so when your endometrium is bulging into that wall, that is endometriosis. So a lot of people suffers from endometriosis and they don't even understand why. Well, first off, it's from hormonal imbalance. Absolutely caused by hormonal imbalance. It is signs and symptoms of those is like pain during menstrual cycle, pain during passing your bowel movements. What's your question? Yep. So painful defecation, painful menstrual cycles, and pain during sex. Some causes is overuse of hormones. Overuse of hormones. When I say hormones, I'm talking about like the Depo shots. I'm talking about like spermicides, like the cream that you put into your vagina, birth control patches. All of those are increased in your overuse of excessive hormones. Another thing that I found out during my research and in my years of studies is with endometriosis, and this is the same thing with polycystic ovarian syndrome, and the same thing when it comes to fibroids. Y'all, so you know how now they're having like those processed vegan meats, right? I can't say, the names, but they have those processed vegan meats and they're very popular. And it's like, oh, come here and eat this meatless this, or no meat that, or surprise, no meat here this, or those things are full of estrogen and full of hormones. And those, if you eat too much of that, even that isn't good for you. That is why I push and overexert and tell y'all that y'all growing your own food, educating yourself, knowing what you put into your body is extremely important. So when you begin to have these things like endometriosis and you're trying to figure out why is your endometrium on the outside of your uterus, why is your endometrium protruding into your anal wall, and then you go back and say, well, let me eat healthier. Let me go get this meatless burger, this meatless this, let me go buy this brand of fake sausage links. It's like that right there is it. Believe it or not, look it up. Look it up. That right there is also a cause of increase in your estrogen and your increase in hormones. So be mindful of what you put into your body. Be very, very, very mindful of what you put into your body. And I cannot say that enough. Wearing really, really, really tight clothes. Wearing really, 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 yes. Wearing really, no, not soy burgers. Somebody asks if soy burgers. No, not soy burgers. I'm talking about those meatless burgers, and it you don't know what it is. It's just a bunch of ingredients on the back. That's what I'm talking about. I'm not talking about you making your own soy burger, your own portobello mushroom burger. That's not what I mean. And that is a great question. That is a great question. So thank you for asking that question. But no, not like a soy burger or a mushroom portobello burger. They have these. Yes, somebody wrote it in the comments. Sweet Nubian. They have these companies that are making meatless processed foods, and it's not soybean, and it's not mushrooms. It's other, chemicals that are man-made. And so then what they're doing is you're eating it, you're consuming it because you're saying, okay, this is healthier, this isn't meat, so I could eat this. But what they're not saying is it's full of estrogen. It is still full of hormones. And so when you begin to have polycystic ovarian syndrome, when you begin to have symptoms of dysmenorrhea, and we all know dysmenorrhea means difficult urinary cycle, menstrual cycle. So when you start to have those kind of symptoms, I want y'all to at least be mindful. Now, I'm not on here to tell y'all to just change your entire lifestyle, because I know some people who the one thing they say is, well, I've been doing this long. It's about you guys making a well-informed decision and understand what's impeding your health and understand what is causing the impediment of your health. That's what this is about. Now, after you gain this knowledge and you do whatever you please, then that's fine. But at least you can say that I know now. At least when you start to have those signs of heavy discharge and foul odorous menstrual cycles, you can say, okay, maybe it was because of that burger that I ate. Maybe it was because of this that I ate. Maybe it was the alcohol that I consumed. So at least now you know. So the next month, you can take care of yourself. So you can get ahead of it. So that's what I mean when I say primary care. Primary care is primary is yourself. Initial care. You knowing one body. So knowing yourself and paying attention to your body, because your body gonna tell you something is wrong with it before a physician does. And when you start to have those signs that something is going on with you abnormally, you can get ahead of it and say, okay, maybe it was my diet. And then you make sure you do your self-exams, your self-health exams. And then once you go to your self-health exams, then you can go to your physician if what you're doing at home isn't working. But to just run straight to your physician and then they put you on some medication, they give you this pill, they say you come get this diagnostic study done, go take this medicine, he go to gynecologist, take this more medicine, and you still eating the same foods. You see what I'm saying? It's just better to know. And that's just all I'm here to do. Is I'm not trying to make y'all completely change your life, because like I said, and being transparent, me being in the medical field, I wasn't living all that I was preaching. I knew what I wasn't doing a lot, because I was in the medical field, but I was still eating beef and pork and fried this and fried that and drinking wine, and I was still doing it all. But and then you get a little older and you say, well, wait a minute. So now I see why this is happening. So now let me stop it before it gets worse. So now that it's preventative and it's reversible, let me get ahead of it before it becomes worse. And that's all I'm here to do for you all. So before we get into the we're going to still stay on endometriosis, because I want to talk about toxic shock syndrome. So let's see, do we have any more questions? I'm trying to get healthy and I'm 52. They haven't been helping me with heavy periods. We're going to talk about that. There are going to be some herbs. I'm telling you, Latanya, there are some herbs, some remedies, things you can do at home that can help with your menstrual cycle. Because the first thing I'm going to do with you being your age and having heavy menstrual cycle, I'm going to ask you, do you eat red meats? So can you answer that in the comments? Do you eat red meats? Red meats, lamb, red meats, beef. Do you eat a lot of dairy? That's the first thing I'm going to ask you, because if you haven't had menstrual cycles, then that lets me know that your acid level is extremely elevated, and I want to know what's going on. Yes. So thank you for being honest. I appreciate that. So the first thing that I would tell you to do is to stop. Stop. Drink you some coconut water. Start drinking your H3O2. Now, H3O2, start eating your H3O2. H3O2 is, you can get those in your fruits and vegetables that contains a lot of water. Stay hydrated. Drink a lot of water. I'll tell you that right now. And I think that's what I'll do. I think that the way I'm going to start doing this is just going over one disease process, give y'all some time to respond, and then we have a conversation before moving on to the next topic. Okra water, coconut water, and I'm talking real pure coconut water, not the coconut water that's in a bottle in a store that got a name brand on that says the ingredients on the back is 4 or 5 different things. Go get you some coconut. Get you some coconut water, or make sure it's all natural coconut water. All organic. That is what I would tell you to do. And by stopping eating, when I say stop eating the red meats, is because you're throwing your body into a metabolic acidic state. And so you're full of toxins. And so during your menstrual cycle, and even fried foods, alcohol, drugs, all those things. And by drugs, I'm talking about any drug. I'm not here to be specific. Overuse of ibuprofen. Overuse of ibuprofen. Now, as us women, this is what I'm going to say about that. And I have to be completely transparent. I've never been one that was big on medicine. Never. I mean, I'm in the medical field, and I just rather just heal myself. I know it's synthetic and it's full of a lot of chemicals, and it's just that medicine messes up this disease, this liver, it's a lot. So that was never my big thing. So as women, when we have our menstrual cycle, the first thing we do when we have menstrual cramps is we go to an analgesic. We go to an analgesic, whether it is ibuprofen or whether it's Tylenol. You see what I mean? I'm not gonna say what they don't tell you, what we fail to realize, because I know some amazing physicians that actually does say, be careful with how much ibuprofen you take. But there is a toxicity. There is a certain level of toxicity when you're taking too much ibuprofen. It's an NSAID, a non-steroidal anti-inflammatory drug. It is an NSAID, and it is filtered through your liver. So it could also later on lead to liver disease. Tylenol is filtered through the kidneys. That can lead to overly excessive use, can lead to kidney disease. But before we get to those disease processes, we not get to those. But before we get off the topic, when you're going through your menstrual cycle and you're in pain, the first thing we want to do is relieve ourselves of that pain. We want to alleviate the pain, and to do so, we take some pain medicine. We drink some water. We go lay down with a hot pack and just pray it all go away. Instead of someone saying it's your diet. Still put your warm pack, still go sit in a soothing bath, because when you sit in a soothing bath, you're relaxing your uterine wall, you're relaxing those muscles, so they're not as contracted. Stop when you're on your menstrual. I would not advise you to drink cold water, because cold makes your blood vessels constrict. It makes your muscles constrict. So it's going to further increase your pain and your cramps. So you want to drink room temperature water. You want to soothe yourself in warm baths. Massage the uterus. You see what I'm saying? If you want to know, now I'm going to tell y'all a little tip, because we don't say the herbs and stuff for later. But what I'm going to give y'all a little tip here. This is what I started doing. I told y'all when I was first doing the fast, and I started noticing the decrease and the significant change in the characteristics of my menstrual cycle. But one thing I want to say is, even right now to this day, let's say I have a cheat day. And what I mean by cheat day is I try to eat as much fruits and vegetables and water. I try to do that as much as possible every now and again. Like I always say, I still eat my seafood. So let's say I'm eating my seafood, I'm eating my sea bass, I'm eating this, I'm eating sushi. Let's say I have my cheat days and I eat, those type of foods or whatever. When I know when my cycle is about to begin. So when I'm getting to a point where I'm getting ready to hit my menstrual cycle, do y'all know what I do? That entire week before, I go on a detox. I go on a complete fast where it's nothing but fruits, mainly vegetables. But I'm doing my juicing, I'm drinking my smoothies, and what that's going to do is that's going to kick on your defense mechanism, your detox mechanism, which is your urination and your defecation. So I'm going to defecate, I'm going to urinate a lot in that week. So then next week when my menstrual cycle comes, it's extremely light. There's no odor. See, because I already detoxed prior to the detox. You see what I'm saying? So if you're that person who's having dysmenorrhea, let me just drop those gems on you now. Thank y'all for the gifts. I really appreciate it. I really do. God bless you. God bless you. And so if you're a person who having foul odorous menstrual cycles, thank you for the gifts. Thank you. Who is that? Shireen? Shireen, you're awesome. Thank you, Shireen Sweetness. And I say that because I want y'all to know what I did. I'm going to tell y'all what I did. I'm going to tell y'all what I'm educating others to do so. And I'm going to tell y'all what I'm learning along my process. Thank y'all for the gifts. Thank y'all. Y'all, maybe I'm going to start doing this every day. I'm going to come here every day because y'all learn and y'all appreciate it. And that's all I want is appreciation. That's all I want is appreciation. And then I will be here every single day talking about whatever it is y'all want to talk about. That is what I'm here for. This is 15 years in the medical field. 15 years of experience. And I want you all to know this, so y'all will teach y'all daughters and y'all granddaughters. And men, if you're on here, teach your daughter and your granddaughter as well, and your wives, okay, who is not here on this live. And please be sharing and inviting people to this live, okay? Men, if y'all are here, I don't know if y'all on here, I don't know if it's predominantly women, but men, if y'all are on here, we're getting to y'all next. And we're going to talk about erectile dysfunction, infertility. We will be discussing men next. So men, hold on, okay? Y'all are coming. All right. So we have young women who are uneducated. They know the basics of a menstrual cycle. You're gonna have a menstrual cycle. You know, you're now fertile. You can now become pregnant. Change your pads. Blah blah. You know, right front to back. We give them the basics, but they don't know that what they consume in their bodies potentially, well, not potentially, it determines the outcome of your urinary cycle. You see what I'm saying? Hormone imbalances. And when our children becomes teenagers, I don't know about you all, but a lot of people put their children on birth control. They're teenagers, not children, but they're teenagers, 16, 17-year-old daughters. No, go get birth control. And I am not against that. But what I will say is at least let them know that what the long-term effects of those birth control uses would be. And that's our job to educate ourselves. We can't keep relying on a physician to tell us everything. We can't rely on nurse practitioners and our healthcare providers to tell us every single thing. They're going to say the direction is take it this way, take it that way, take it like this. Don't do this. Don't miss a pill, because if you miss a pill, you can get pregnant. They're gonna tell you the basics. They're not gonna say long-term use can cause polycystic ovarian syndrome. Long-term use can cause you to have elevated estrogen levels, and it can lead to dysmenorrhea. Long-term use can lead to fibrogen cysts on your breast, and you doing your breast exam, you're trying to figure out what is this lump in your breast. You see what I'm saying? They're not going to say long-term use can actually cause infertility. I can't begin to tell y'all how many patients, do y'all know, like those little marinas? Do y'all remember those marinas? It was like, and I don't know, I think they discontinued it. But what they did was they had, they used to put those in your vagina. And then so many people started to come back and complain that it either moved or it fell out or it was poking and stabbing them or it wasn't in the place that it used to once be. You know what I mean? And it was just like, somebody said, thank you, I'm getting off. I have one in my arm. That's the implanton or the Nexplanon that goes in your arm. And so it's like, but it's one that goes in the vagina and it looks like a little, like a Y shape. And so they put that, it's an intrauterine insertion into the uterus. And so many people was coming back with infertility issues, having to have partial uterus removal surgeries, okay? Which is called a hysterectomy. You see what I'm saying? And so that's like, you cannot rely on your physician to tell you every single thing, because I got to be transparent with you. The name is in the field. It's called practice of medicine. Practice. Not this is guaranteed expert 100%. That's why if you look at it it is illegal for a physician or for a pharmaceutical company to say 100% cure, 100% this, 100% effective. They can't say that because then they could be sued. So they say, yeah, the IUD. So they say 98% or 95% or the probability of this, or that's what they do. And so what I want you all to know that is it is your due diligence to do your own homework. It is your due diligence to do your own work yourself. And then you pass that down to your children and tell your children, okay, you're right. They tell you, they don't tell you, no, you say you're right. They tell you everything. They don't. It's up to you to know. It's up to you to know everything, okay? And a lot of times it doesn't even prevent you from being pregnant. I know plenty of women who's gotten pregnant while on birth control, okay? So I just want to make sure I make that clear. Now, before we get into toxic shock syndrome, is there any more questions? Any questions? We talked about endometriosis. We talked about dysmenorrhea. So we're going to talk about toxic syndrome, and then we're going to talk about polycystic ovarian syndrome and infertility in women, okay? And then some of y'all got to go. If this lab is going too long, y'all got to go to work, or y'all come off y'all break. Just go to my YouTube channel, Higher Levels with Shay. I will post this recording on my YouTube channel, okay? And y'all will have this whole recording. I usually do a part 1 and a part 2, okay? God has been good, never taking birth control. Thank you, Jesus. Amen. I know someone who's gotten pregnant. Absolutely. Oh, that'll be amazing. Let's tap to 20K to support this information. Yes, please tap, tap, tap. If y'all can double tap. Thank you so much for that. If y'all could double tap the screen, show some love. My cousin had a surgical remove because it moved to a different part of her body. Absolutely. You go in there and you want to prevent yourself from being able to have babies, and then all of a sudden you come out and you have a partial uterus or no uterus at all, or you infertile and you can never have a baby again. Or you have to go through multiple surgeries of getting cysts removed because you're trying to have a baby, because you're trying to prevent yourself having a baby as a teenager. When for me, I always say the safest thing to do, of course, anybody that say abstinence, who's really gonna that? Let's just say abstinence. But the second thing is condoms. And let's dismiss the myth of condoms. And people say, I can't feel it. You could. It feels the exact same way with the condom as it does without a condom. And so you do it with the condom, and let's teach our youth coming up behind us that to use condoms. They prevent a lot of STDs and STIs. I don't say 100% all. They prevent a lot of STIs. And you are less likely to have infertility issues due to the exposure to hormones, because you don't have that overexposure to hormones from condoms, okay? Thank y'all for the double taps. Thank y'all for the gifts. Thank y'all for the hearts. If y'all liking this live, please share with others and invite them to this live as well, because I want them to get into it as well, okay? So now we're going to get into toxic shock syndrome. So toxic shock syndrome is a rare but potentially dangerous disease process, and that is due to overexposure to an infection. Okay, overexposure to an infection. Now, what's causing that infection? I'll tell y'all what causes toxic shock syndrome. It's the infections. What causes the infections? When you leaving tampons on, when you leave your tampons in too long, that can cause toxic shock syndrome. During intercourse, if you have multiple sexual partners and you're not even protecting yourself, that can lead to toxic shock syndrome. We had a patient that came in and she had a very foul odor down there, and they did an exam on her, a pap smear, and she had a broken condom still in her vagina. And that led her to have toxic shock syndrome, which is ultimately called sepsis. Sepsis. Sepsis is when a toxin get into your bloodstream and you become so sick where you have a fever, you have very low blood pressure, very low heart rate. Those are signs of sepsis, okay? So another thing that causes it is not changing your menstrual pad. Not changing your menstrual pad as often as you should. Poor hygiene, improper cleaning of yourself. We all know that we're supposed to write from front to back, never back to front. You do not want to put the toxins and the germs in a defecation from your rectum or your perineum into your vaginal opening or into your uterine wall. Into your uterine wall, that can lead to a UTI. But we're not on the kidney. We're on the reproductive system right now, okay? So there are some things, some causes of toxic shock syndrome. Tissue damage. Tissue damage can lead to toxic shock syndrome. What causes tissue damage? We all grown here, enlarged penises, rough sexual intercourse, objects like sexual toys, in the vagina that's too big can damage the tissue. And when you're damaging the tissue and it isn't healing properly, and you leaving that opening for germs to get inside of it, that can lead to toxic shock syndrome. Some of the signs and symptoms are fever. What is a fever? Fever is pretty much known as anything over 1 degree over your normal temperature. The normal temperature for your body should be 98.6. So 99.6 and above. Toxic shock syndrome. And I mean, it's sudden. It's not like it's slight. I mean, it's sudden. Just going through the roof. Thank y'all for the likes. Double tap the screen if y'all are learning anything. I really appreciate it. Flu-like symptoms. You having body aches. You're nauseous. You're starting to have some fever and some chills. Not necessarily a cough. When I say flu-like symptoms, I'm not talking about a cough and a runny nose. I'm talking about chills, body aches, fever, low blood pressure. That is toxic shock syndrome. And also, like I said, it is known as sepsis. So what are some preventions of toxic shock syndrome? Proper hygiene, wiping from front to back. And what I take is the next step further is I always get water and clean my vagina after every intercourse or after every bathroom at the bathroom use. So every time you urinate, clean. Don't just get tissue and wipe yourself, because that's not really getting the rest of the germs and the bacteria. The proper way to clean yourself is from front to back. If you want to use tissue, and then you get water and you pour water, and you just excrete water. There are a lot of people who do what is called CYSTS baths, or they have bidets. You see what I'm saying? So that is proper hygiene. Proper hygiene can prevent this. Proper use of tampons and proper use of pads and condoms during sex, and being mindful of your sex partner's anatomy size. That honestly, that is the truth. So be mindful of the sexual partner that you are dealing with, okay? Now, do we have any questions on toxic syndrome? No, that was pretty simple, straight to the point. But do we have any before we start getting on PCOS, and fibroids? And we talk about fibroids, we're talking about fibroids in the uterus, we're talking about fibroids in the breast, and we're talking about the cyst that's on the cyst. So any questions before we get into the fibroids? All right, so let's get into fibroids, and let's talk about what is called fibroid. It's called fibroadenoma. What was that, a question? You are so welcome. You are extremely welcome. This is absolutely my pleasure. I wrote down some notes here because I said I don't want to miss anything. I hate when I do a live and then I realize I didn't talk about this, I meant to talk about that, and then I can't go back and redo the live and say, hey guys, come back, one more thing. So I found it it's better for me to just start writing down my notes. Okay, you have a question? I'm here. I want to hear y'all questions. I want y'all to respond. We are all family here, and I'm here just to help y'all. So go ahead and type your question in the comments, and I will be happy to answer your question, okay? What's your question? Whoops. All right, so she says, does abusive relationships make fibroids worse? Overall answer to that is stress makes fibroids worse. Any form of stress, abusive, toxic relationship. And when I say abusive, it can be verbally, mentally, emotionally, spiritually, financially abuse, love bombing, making you feel like you're the only one, but then he's cheating and there's 15 other ones, or, so those, any type of stress, anything that is causing that is impeding your peace is too expensive. It's too expensive because that comes with not only physical disabilities, but mental disabilities. Now you overwhelmed, now you have anxiety, now you're depressed, now you're low self-esteem, now your body's going through some changes and abnormalities. Anything that is causing you to lose your peace, get rid of it. I don't care how good it looks, how good it smells, how good it tastes, how good it acts, how good it make you feel. I don't care. If any end, it is causing you to have physical, mental, emotional, mental distress, get rid of it. Except your children. You can't get rid of our children. So, but I just want you to know that. So when you said that, I thank you for asking that question. Thank you for being open. Like I said, we all here. We all been through it. So we all been through it. So at the end of the day, get rid of it. I don't care if it's a family. I don't care if it's a friend. I don't care if it's a coworker. I don't care what it is. If it's causing you your stress, get rid of it, because what you put up with today, you're going to pay for it tomorrow. You're going to pay for it tomorrow. While they going about their lives, you having heavy menstruals, you cramping, you having infertilities now, you having fibroids now, you having mental disturbances, you having anxiety now, and they're going about their business to the next one. So don't even set your boundaries. That's one thing I will say. Learn this hygiene, learn this knowledge, and at the same time, start setting boundaries. And when you start setting boundaries for yourself, what you do is you attract the right people in your life, and you get rid of the people who are just there for their own self-satisfaction in the first place. So you do that, you attract the right people, and how we treat ourselves reflects how others treat us. How we feel about ourselves reflects how others are going to feel about us. So if you're in a situation or in a circumstance where, or around certain people that is causing you to, for your body to be out of homeostasis, for your body to be out of whack, then being real, that says more about us as a person than the other people, because we should love ourselves enough to say, you're not worth it. You're not worth it. Okay. So yes, abusive relationships can absolutely cause fibroids to be worse. Okay. So I just want to make sure I say that we all family here. We all can, this is kitchen table talk, so we can all be honest here on a higher level shade platform. Okay. So thank y'all. So we're gonna get into I didn't start it already, but let's get into the fibroids. Let's get into the cysts. What foods can you eat to help with? Okay, so we get into fibroids now. We're getting into fibroids now. Somebody said, this is my question. All right, what's your question? Go ahead with your question. Recently learned I have a 20 centimeter mass on my ovaries. I want to naturally get rid of it if possible. We're going to talk about that. We're going to talk about that. And so with that mass, is it benign? Is it malignant? What did they say about that mass? Did you get further testing done to see exactly what it is? Let's talk about that, sister. Okay, good. So it is benign. Glory to God. Glory to God. And it's never too late. I'll tell you that now. It's never too late. So let's get into it now. Anybody, like I said on this lab, if y'all have to go, I understand, but just make sure that you go to my YouTube channel. And then my YouTube channel, I will be posting this video, okay? So, and then tomorrow we'll be talking diabetes, and we're talking about the pancreas. So tomorrow is diabetes and the pancreas, and we'll talk about what herbs and fruits and veggies you can take and lifestyle changes you can make to help regulate your blood sugar, okay? And help to increase your pancreas and your insulin production, okay? What about intermittent fast to help manage fibroids? Yes. Yes, yes, yes. So don't miss the diabetes one. And then I think Saturday we were talking about blood types, the different blood types, A, B, B, and O. That's what we're talking about Saturday. We're talking different blood types and the lifestyles you should take with your different blood types. And then on Sunday, we haven't come up with a topic yet. So I don't know. We're talking about mental health Sunday, or will we be talking about autism in children, and those children are like sickle cell disease processes. So, well, sickle cell will be with the blood type. So since that's a blood disorder, we're gonna do blood period on Saturday, 4 p.m. on Saturday. So we're gonna talk about blood period, and that's going to cover sickle cell anemia as well. Okay, so let's get back into it. PCOS is polycystic ovarian syndrome, and that's when you have a lot of cysts, multiple cysts on your ovaries. What causes multiple cysts on your ovaries is this. What causes multiple cysts on your ovaries is overuse of hormone therapy. We talked about that. Birth control. We talked about the foods, all those processed foods, all those. Actually, this is the same thing for fibroids, the fibroids in your breast, and for the cysts, because if you think about it, the cysts forms into into fibroids. Okay, it leads into fibroids, and then the fibroids begin to grow. And then we'll talk about what's causing the fibroid to grow. Okay, so let's go back. So polycystic ovarian syndrome, all three disease processes, y'all, this is the same thing for all three disease processes. So for all three disease processes, high estrogen level, extreme high estrogen level, hormone imbalance, overuse of contraceptions, overuse of your poor eating, lack of water intake, those are some causes. Caffeine, increased caffeine use. So you're a caffeine drinker, and I say caffeine, tea is caffeine. We all know coffee, soda has caffeine in it, and chocolate. Somebody asked how to get rid of excessive hair on your face. That is an over excessive production of hormones. So those herbs and everything is going to be at the end, because you can get rid of stuff with just balanced natural hormones, and we'll talk about that. Okay, so make sure you are following the page for that. Somebody said I have my hand up. Just put it in a comment, because I don't even see your hand. I'm sorry, you're not being ignored, my love. I don't know why I would see a hand gesture, but I highly encourage you to put it in the comment, and then I'll get to you, okay? Somebody asked how to get rid of fibroids. We're discussing that. We're talking about that. We're talking about herbs and hormones. Herbs, fruits, and vegetables that you could take. And that's towards the end. When we get done with all this, we'll be talking about those herbs. And I want y'all to have y'all pens and papers ready, okay? So double hearts, double tap the screen. Thank y'all so much. Listed everything I've been doing. Oh, she says, I lifted my hands up because I got caught because you listed everything that I've been doing to get PCOS. I thought you was raising your hand like in class. Well, absolutely. Like I said, 15 years in the medical field, 3 years of certified herbalism. So those are things. So drinking a lot of soda, drinking a lot of tea, drinking a lot of caffeine. Chocolate has a lot of caffeine in it. You're overproducing hormones, overproduction of hormones. And the crazy thing about this is, although it's put in our face, we're consuming it ourselves. So our body isn't attacking us. We're attacking our bodies. So now is the time, this education and this knowledge is for self-accountability as well. I love you for raising your hand. This is why I love this platform. We all could be honest 100% with each other. And this is a no judgment zone. We all going through our own things in life. So that is absolutely it. Alcoholism, smoking can also cause overproduction of hormones, and like I said, alcoholism. And the thing is, they dehydrate you. Anti-inflammatory drugs can cause the overproduction of hormones, PCOS, fibroids. We talked about the anti-inflammatory drug. I called it an NSAID. Can somebody put it in the comments? What was an NSAID? What was the one drug, the analgesic, non-steroid anti-inflammatory drug that we talked about? And I put it. So somebody put it in a comment for me, okay? Wearing let me see. Ibuprofen. Good, kissy face. Ibuprofen. Yes. So we talked about PCOS. We talked about like I said, it's all the same thing, like the PCOS, all the same, like main cause, the overproduction of hormones and what's causing that overproduction of hormones. And so now that we got that, y'all get y'all pens and Tylenol. Yes, y'all get y'all pens and paper ready, because I do want to talk about these herbs, okay? I want to talk these herbs. And the PCOS, is it reversible? Yes, it is. Is it reversible without surgery? Yes, it is. But it's up to you. It is all up to you for the lifestyle change, okay? And y'all ready for the herbs? And y'all be ready to write these herbs down, okay? All right. Y'all ready? We're gonna get into these herbs. We're gonna do the males. Men, y'all don't go anywhere because the males, we're gonna be talking about you all next. I'm gonna give out these herbs, and then we're gonna take some more questions from the women. And then after that, we're going to go into the male reproductive system. Okay. Now, you know what? I didn't do let me see. Vegan diet, protein shakes, intermittent fasting, cheat days on weekends. All right. Now, I'm going to briefly cover menopause. I saw somebody say something about menopause. I'll briefly cover it because it's not like it was something that caused. Now, early menopause obviously comes from hysterectomies. Early menopause also obviously comes from infertilities. So we cover when it comes to early menopause. But natural menopause, in its normal stages, that just simply comes with the decrease in hormone production. So menopause comes with decrease in hormone production. You start to have different changes, some age-related changes. When you get older, you start having a decrease in vaginal secretion, which is why you're going to get these herbs as well. So for those in here who are experiencing premenopause or menopause, and then what do you classify? I'm talking two things. What do you classify as menopause? Menopause is when you miss your menstrual cycle for an entire year. You go an entire year without a menstruation. Premenopausal is when you having a missed period, like you have an abnormal period cycle where you will be on your menstrual cycle like in January, you'll miss February, March, and then you have one in April, have one in May, miss one in in June, miss one in July, have one in September, miss August, September, October, then have one in November. And so those are your premenopausal stages or your premenopausal ages. Signs and symptoms. Now, the menopause is when you go a complete year without any menstruation at all, and you're not on any birth control, nor do you have some pre-existing condition. Okay, so that's menopause. With age, with women, we have with these herbs are going to help, but loosening of the vagina, dryness, increased dryness of the vagina. You're going to have a decrease in your menstrual cycle until it completely completely stops, and of course, breast drooping and things of that nature. Now, I'm going to tell y'all about a couple of things here. We got different herbs for polycystic ovarian syndrome. We're going to have different herbs, and if y'all want me to give y'all, I got herbs written down actually for everything, but what I want y'all to do is, if I go over a disease process if I do not go over the disease process and you want me to talk about those specific herbs, like let's say somebody who's having difficulty producing milk production, like you don't have an issue with getting pregnant, but once you have your baby, you can't produce milk. Even questions like that, I do have herbs written down for those as well. Let's see what else you have to ask me. Miscarriages, those who are constantly having miscarriages, we have one great herb for that. Okay. So let's talk about fertility. I'll go down the line. How to increase your fertility. I'm going to say these herbs, and then I'm going to, and for the herbs that I feel like I need to spell, we're going to spell them out. So evening primrose oil, false unicorn root, licorice root, Rhodalio rosaro, and yes, I would spell that. It is RHODIOLA ROSEA. Water plantains, yams. Yes, like the yams you get from the stores. Okay. Saw palmetto, SAWPALMETTO. Saw palmetto. Do your research on these herbs for disclaimer, because certain herbs counteract with certain medications. She said, can somebody please put these in the message? Certain herbs interact with certain medications, and certain herbs you cannot take during pregnancy. So if you're on medication, if you already have a pre-existing condition, if you have an allergy or if you're pregnant, I need you to make sure that you are absolutely researching these herbs. If you don't have any of those issues, doesn't matter. Research these herbs. Educate yourself on the herbs, the benefits of it, and some contraindications of it, just in case one day you need to have this information. Arm yourself with as much information as possible. Okay? Solomon's seal. Solomon's seal is amazing when it comes to fertility. So we're talking about fertility, how to improve fertility. All right? So y'all got that down? Now we're going to go to menstrual cramps. So we're talking menstrual cramps, and in addition to menstrual cramps, we're going to talk dysmenorrhea. That was a difficulty with the urine. Evening primrose oil. That was the first herb I mentioned. Evening primrose oil. Evening primrose oil. Menstrual cramps. Bloodroot. Bloodroot. Blue cohosh. Blue cohosh. COHOSH. Cattails. CATTAILS. Cat's claw. Sweet marjoram. Wild rose. Stinging nettle. And I'll tell y'all something amazing. Stinging nettle, wild rose, greater burdock, all of these things is found in your backyard. They're in your backyard. We're not privy to them because we're taught to destroy them when we start to see them coming up, and then cut our grass and keep a clean lawn. You see what I mean? But do your research on these herbs before you go and destroy them and spray the chemicals on these herbs, on those plants. Do your research. Google it. Okay? Google it. I can't, y'all should see my neighbors at first when they saw my stuff. You got a lot of weeds in your backyard, baby. I said, that's not weeds, that's medicine. No, that's medicine. Yeah, but you gotta cut them down for the homeowners association. They can't tell me what to do in my yard. They're medicine. And I want to tell you, and I'm going to invite you over here so that I can educate you on the medicinal uses of this plant that you're telling me that I have to cut down. If somebody say that's why the animals eat them, if nature doesn't want them, then why would you? If the animals doesn't want to eat it, then why would you want to eat them? You eat what the animals eat. Eat what nature provides. God did not provide us here on this green earth with this great vessel for us to fulfill his purpose, for us to fill it up with toxins. And I know that the flesh is weak. I know that we're going to fall victim to it, but then understand how to detox and cleanse yourself. Understand how to heal self holistically. We got to cleanse the physical to get to the spiritual. Proverbs 11 and 12. All right. Fennel. Fennel is a herb, and you can find that's a spice that's in the stores. Like it's in the same spice racks where you can find like your sage and your parsley and cilantro and all those different spices and stuff like that. You can also find marjoram in the grocery store as well. If you want me to be honest with you, peppermint, yarrow, mugwort. That's MUGWORT, and dill. You know what else is a good one? Calendula. Now, you want to talk about fruits? Again, those H3O2 fruits, your watermelons, your melons. I cannot stress that enough. Papaya is amazing. Oranges is amazing for the breast. Oranges are amazing for the breast. Those citric fruits are amazing. Oranges, lemons, limes are amazing. Cranberry, amazing. Simply amazing. So while I'm giving y'all herbs, I'm just thinking about all the, even just the different fruits and vegetables that can be, that are just extremely, extremely important. Berries, get into your berries. I cannot stress that enough. Blackberries, blueberries, elderberries, mulberries. I don't care. Pick a berry of choice and then you enjoy it. And then you can add other berries to, like the berries that you really don't like that much. Like a lot of them like raspberries. Raspberries are amazing. But you can add that to your juices with your blueberries and your grapes and your blackberries, whatever else you like. You see what I'm saying? Grapes, 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 grapes. How am I able to review this info again? This info is found on my YouTube channel. My YouTube channel is Higher Levels with Shay, and I will be posting this on my YouTube channel. If not tonight, definitely tomorrow. So go subscribe to my YouTube channel, like and follow my page. We're going over. I do this 3 times a week. We go over this Saturday. I mean tomorrow, not Saturday. Tomorrow we'll be going over diabetes in the pancreas. My YouTube channel is Higher Levels with Shay. So make sure y'all go to my YouTube channel. Okay? And then share this information with your friends. Share it to your Facebook. Copy the link to your Facebook. Copy the link to your Instagram, your TikTok. Do whatever you got to do to share this information. You see what I'm saying? All right. So let's talk about a healthy menstrual cycle. Now I'm going to give y'all some herbs for a healthy menstrual cycle. Okay? Somebody said, what about the seeds with the fruits with no seeds? It's man-made. Yes, it is genetically modified. Absolutely. I grow my own fruits. I grow my own vegetables. I grow my own herbs. I do still shop at the local farmers markets, and whatever herb or fruit that I don't have at home, I do go out and get it, but I make sure to get the organic ones, okay? So while I am in the stage of cultivating my own land and being more self-sufficient, I still go out and purchase what I don't have right now until I get it. So nothing happens overnight. And one day soon, I won't have to deal with the grocery store or any store for that matter for a long time. What helps with acne and skincare? We'll talk about skincare. This is all about the reproductive system as a whole right now. I like to stay constructive and do things orderly. So in decency and in order. So we'll get on skin conditions later. Okay, we'll do a whole lab about that. Thank you. Somebody said you are providing some amazing information. Thank you so much. Y'all heart the screen if y'all liking it. Share the screen if y'all liking it. Invite other people to the live if y'all are liking it. I do appreciate that so much because I want to be here to help y'all. Okay. So for menstrual cycles, for normal menstrual cycles, you want to do the same thing. All those herbs, the same thing. Thank y'all for the likes, but I want to add some additional herbs. Bee balm, lemon balm, quacking aspen. I think Bobby, you have to actually send it to her. Like hit the arrow where it says share live and actually send it to her. I don't know if you can just, I'm not sure if you can just add her into the live, maybe so. But if you just hit that share, live button and then send it to her inbox, you should be able to do so, okay? All right. Wild ginger, licorice root, burning bush, and borage, Borage. Oh, I don't know who that is. I'll be in my own world, y'all. I'm not gonna lie. And then Lovage, Lovage. I'm gonna throw this in there only because I see this so much. If if you habitually have miscarriages, I want y'all to know that unicorn root is really, really, really good. So unicorn, I want y'all to get the unicorn root and get false unicorn root. False unicorn root is amazing. And like I said, yams. So I don't want anybody to be suffering not only infertilities, but becoming pregnant and then having miscarriage because of their disability, they reproductive disabilities or impairments. Okay. So I want to just make sure I put that out there just in case. I just felt that in my spirit to say that. I don't know if anybody want to put that in their live. Put that in the comments. But if you were thinking about it, but you was didn't want to put it in there, then I highly tell you to do unicorn root. Okay. So unicorn root, false unicorn root. Research those, detox yourself, get your hormones back in balance, and then do your research on this unicorn root, okay? And then you and some of these other herbs that we're going to be going through, okay? All right. So for those who polycystic ovarian syndrome, y'all ready? ASH, ASH. Like ash, black cohosh, evening primrose, sweet marjoram, unicorn root, and reishi mushrooms. REISHI, reishi mushrooms. And you can take these herbs in teas. You can eat them in soups. You can take the turn them into a tincture. You see what I'm saying? A tincture is like a medicine into a decoction. There's like another form of taking the medicine. So I'll be doing that's later. I'll be doing a whole live talking about how to turn your herbs into medicine, like how to make them into like actual like tinctures and decoctions and skin wax for those who have skin issues. But for those who just want to put them in your foods, or I'm gonna tell you right now to dry them out. You're gonna dry these herbs out. You can sun dry them, you can freeze dry them, or you can air dry them, but don't cook them. And then you prepare them in tea, or some people like to put them in like they're like an onion soup or some onion and garlic soup. So you prepare it to your liking, okay? All right. And like I said, a lot of these herbs like fennel, parsley, marjoram, a lot of those herbs, you can find those in the spice owl. Right there in your spice owl. Okay. For those who have premenstrual, let's do menopause. So for menopause, the same exact herbs, but I'll tell you kudzu, Kudzu, kudzu. Licorice root, pulsatilla, St. John's wort, watercress, CRESS, saw palmetto, sage, red clover, Solomon seal. Somebody says soup detoxing is legit. Oh, yes, it is. I thought herbs only work if your blood is thin and clear. No, herbs don't only work if your blood is thin. Actually, there's a lot of herbs that actually thin your blood. So if it's too thick and you're having like some clotting issues, there are actual herbs that help thin and detox your blood. So that's a great statement. I'm glad you made it, because I want to make sure I debunk that myth. All right, so before we get into the men, do we have any questions? Because men, we're going to be talking about erectile dysfunction. We're going to be talking about BPH. That's benign prostatic hyperplasia. That's when the prostate is severely enlarged, causing some dysuria, anuria, oliguria. That's difficulty urine, loss of urination. Men, if you're online, or women, if you know some of your husbands or your sons or grandparents or grandfathers who's going through these things, then I want you to make sure you share this information with them as well. Okay? And we'll get into the men. Do we have any questions, though? So to say, oh, thank you. I was called. Did you say any herbs for PCOS? I did. Yep, I went over the herbs already for the PCOS. Let's see. Yep, I went over that for the PCOS, and then for fibroids. That's what I thank y'all. For fibroids, thank you. We have dandelion, garlic, leeks, like the onion, Oregon grapes, Oregon grape, bearberry, borage, pipsissewa, and yes, I'm going to spell pipsissewa, PIPSIS, WE, PIPSIS, EWA, pipsissewa. Let's see. And those right there will help with your fibroids. You know what else will help with fibroids? Echinacea. Now, echinacea is a flower. The roots and the leaves of echinacea. Now, somebody asked a great question. Do you take these all together or can you use them one by one? Now, this is what I want to say. You can take them all together. Like if you want to dry them out and use them in your soup, or you want to dry them all out and put them in a tea bag and make your own tea. Or if you want to, speaking of teas, you can go to this website that has teas specifically for that. So you can make your own tea. But if y'all want the website, I'll give y'all the website, okay? But there is a website that has different teas for infertilities, for STDs, cleansing of STDs and cancer and everything. So you can actually go on a website and you can purchase those teas, or you can make teas yourself and you're going to do it yourself. You can actually put these all together. You could. And then later on another live, we're going to do a whole lab of how to create your own medicine, meaning like tinctures, waxes and everything. Yes, the website, please. I can buy these herbs and vitamins. And increase your vitamin E intake. Increase your vitamin E intake, okay? www.yafashakor.com. Now, they don't sell herbs itself. They sell teas, like the teas that are already made that contains the herbs. You see what I'm saying? So it's YAFASHAKOOR. No, oregano grape. Not oregano itself, oregano grape. Please say it again. Yep, www.yafashakOOR. Thank y'all for the double taps. Thank y'all for the hearts. Thank y'all so much. I really do appreciate it. Let me see. Any more questions? So you go to that website, 110%, and find you anything that helps with different like disease processes. Or you can go to your local herbal store, purchase them yourself, and then you can make your own teas. You can make your own like tinctures, make your own soups, dry them out, make your own waxing for those who, like I said, who have some skin issues, okay? The website is www.YAFASHAKOOR. Can somebody put in the comments, because everybody asking me, can I post it to the site? Oh, post it to the site on my page. Yep, somebody posted it in the comments, so it's in the comment. www.YAFASHAKOOR. Somebody by the username My Heart just posted it in the comment. So that is the page, okay? Yafai Shakur. Yafai Shakur. Yep, that's the website. And like, again, if you're just now tuning in, I will be posting this live to my YouTube channel, which is Higher Levels of Shay. You can find this information there. You can find this information there. So men is not going to be as long as women, because of course women has, you know, we're a little bit more complicated. We got a lot more lady parts to deal with, and a lot more, we're doing a lot more. Men ejaculate, women produce and reproduce. So when it comes to men, it's not going to be that long. I know when we was talking about what a good hour and a half for the women's section. Men, it won't be that long for you. But women, I want y'all to be on here too and stay on this live as well, because we all have husbands, boyfriends, fathers, sons, grandfathers, uncles. We all have somebody who we can share this information with or share this live with. And thank y'all for the hearts. I really appreciate it so much. It makes me want to just keep going, because this information that I am giving you all is, how can I say this? It's not something that will be willfully just given to you all freely by everybody, because the money is in the medicine. You see what I'm saying? Not in the knowledge. And so I just couldn't sit back with me being a strong, powerful woman of God and sitting in my faith and going to work every day, taking care of patients and taking care of whether you're young or old, male or female. I just couldn't sit there and continuously push and educate on the Midwestern medicinal way of practice when I know that there's a whole different practice out there that can work. You see what I'm saying? And so I encourage you all to do your own research, and I encourage you all to gain this same knowledge. You don't have to go to school to have this knowledge. You don't have to have a degree to have this knowledge. All you have to do is just have the knowledge. And so I get on this platform and I share this free knowledge. I don't charge anyone for anything, because I feel like it's important for the masses to just at least know. That way you have a well-informed decision. So when you are living your lifestyle and you are maneuvering through everyday life, and you start to have some difficulties or abnormalities in your physical, your physical, at least be aware of where it came from or what the cause was, instead of you being oblivious to what the root issue is. And it's simply our diet. What we are not in control of, I want to make sure I make this clear, gentlemen, I'm getting to you. What we're not in control of is the polluted air that contributes to toxins in our body. What we can't control is the radiation that contributes to the toxins in our body. But we can control the amount of radiation exposure, meaning reduce your use of cell phones. Don't have your cell phones on your body. You see what I'm saying? We can't, when you go outside and you breathe in the air, we may not, but you can detox. You can get your air purifier in your home. You can get you some natural plants that helps purify the air organically. So at least when you're at home, you're not breathing in the toxins. Then when you go outside, you are, and then you come home and you detox. See, these are things that we are in control of. You may not be in control of what they're putting in the foods and how they 3D printing foods and how some of the food isn't even food. You see what I'm saying? We're not in control of those things. But we're in control of putting it into our body and consuming it. So if you know that lamb meat is 3D printed meat, and you know that seedless grape is a man-made, genetically modified grape, then now that is your well-informed choice. And now you know what this fake food and this processed meat and this man-made meat and this 3D lab printed meat and this hormone induced meat and all this other stuff. When you start to do all these things, I know y'all see the videos of some guy, he had a banana and he like kind of bent the banana and it was all rubbery. And I know you all are seeing the watermelons and it's like, woo, what is that? And your food don't taste like food. Eggs tasting rubbery. They don't taste like eggs anymore. Chicken, I don't know about y'all, but when I grew up, my chicken was yellow and now chicken is like this pale pink because it's being dyed. And you know what I mean? Not die as in D-I-E, die, D-Y-E-D, like, you know what I'm saying? So it's like just being mindful of that. And that's all I'm saying. I'm not knocking anyone's hustle. If that's what they want to do, to feed to the masses. Hey, I'm not here to knock down nobody's thing. But what I am here to say is at least educate yourselves on it. So when you put in your body, at least you know what you're putting into your body. At least you know it's a lot of plastic in those noodles. It's a lot of plastic in these pastas that they passing off on. It's a lot of MSG in what they're giving us in these Asian restaurants and Chinese foods. It's a lot of man-made chemicals that's in the fried food chains and the pot pies and in the Chick-fil-A's. And at least you know these things. I'm not telling you anything you can't research yourself. I'm not telling you anything that isn't already out there. I just don't care about saying it out loud. And I want to just make sure that you all are aware of what we're putting in our bodies. Now, guarantee that there's somebody who's still going to put in their bodies. So it's not like money's going to be missed. It's not like those companies isn't going to still get paid because somebody's going to still patronize. But at least now you know. At least you know you're eating fake food. At least you know you're eating man-made chemicals. At least you know when you bite into that Chick-fil-A sandwich, it got over 40-something man-made chemicals in it as a seasoning, but it ain't really seasonings, really chemicals. So it's really like you're eating on a drug every single day when you bite into that chicken sandwich or that Popeyes chicken sandwich. Like, I mean, so when you drinking that alcohol that says spirit on it, you see what I'm saying? And they know that it's poison, it's toxins, and what it's going to do to your body and how it's going to open up a portal for spirits to come in and you don't even remember, or you don't remember what you did when you was under the influence and everything. Like, come on. I mean, it's in our faces. We know these things. I'm not saying anything that isn't already out here. But what I am saying is, arm yourselves with this knowledge. Give yourselves the know-how. You see what I'm saying? Somebody said, that's true. I've been there. I've been there. I do not drink to this day. I don't drink anymore. I've been there. I've been there where you're consuming some alcohol and then all of a sudden you're in this really great space. And then all of a sudden it's like a switch happens and you like, and you could feel the switch, like you could feel when, you know, something else is overtaking you. You know what I'm saying? And you like, woo. And then all of a sudden you're aggressive or you're angry or you're hypersexual or you are extremely irritable or whatever it is that whatever spirit just took over you. And now you like in some space that you're no longer in control. It's like you're there, but you're not there. You can see everything, but you're not in control. And then you turn around and they're like, remember yesterday you said this and you did that and you slapped her and you beat up him and you did this and you did that and you like, you know, like I may have, now not me, I didn't slap beat up nobody, but I mean just people in general. But you know, you do it and then you tell somebody what they done. Oh, they don't remember dancing on that table, or they don't remember flirting with that man, or they don't remember squeezing that girl's booty, or they don't remember doing, and you see what I'm saying, and you just like, you don't remember when you did this, girl? No, I was drunk. You don't remember you did that, girl? No, I was drunk. What on you had did that to that man, and girl? No, I was drunk. You see what I'm saying? It's called spirits for a reason. You see what I'm saying? Somebody said on video. Listen. If your friend is recording you doing something that you know, let me shut up. I won't even touch on that. Let me shut up. I won't go. I'm not gonna go that deep. We're gonna stay focused. I won't go that deep. I am. If your friend is recording you in your worst state of mind, I need you to reevaluate that friendship. I need you to reevaluate that friendship. Because at the end of the day, if I'm in, man, I know y'all probably like, man, we didn't started having girl talk. I'm sorry, man, but I just feel like these are my sisters. I feel like I can just be honest with y'all. And I just feel like it's too much fakeness going on in the world. It's too much delusion going on in the world. Everybody's thought process is all one. Everybody afraid how they saying. They own man. And it's just like, what are we doing in today's society? Like, everybody look like everybody BBL, this. It's just like, I can't. So I just had to get here and just say that. The spirit was just moving me. I just had to just get on here and just be honest, because it's like, if your friend, somebody said record it on video, and that was just for me. Like, if your friend is recording you, I don't care what state, if it's not in your best state, and I'll tell you right now, we've all been in a state, every last one of us has been in a situation or a state where we wasn't our best selves, or what we would not want to be seen in the best light. And if your friend is recording that, or screenshotting, let's say you're drunk and you're texting some stuff and they're screenshotting, whatever it is, I look at it as them collecting evidence for collateral and later on to use against you. And anybody that's building up a case against you is not your friend. That is not your friend. I had to let go of a family member who said some stuff like, yeah, I record everything and I keep texting everything. I take my text message and send it to my Yahoo page from years ago. And I'm like, if I could say it once, 2 or 3 times, I could say it 15 times. But the fact that you felt compelled to even be just saving from years ago and then taking the initial step to send it to your Yahoo page, it's like, what are you doing? So sometimes you gotta just know when people are riding in your corner, when people are in your circle versus a cage. Let me just make sure I say that. Understand and recognize when you are in a circle and when you are in a cage. Okay? So let's be very clear. I just had sex. The beautiful lady in that comment said, yeah, and recorded. I said, well, lady, who your friends? They're not your friends. I need you to abort mission immediately and go find you some people that are like-minded. That's why it's very important for you to hang around like-minded people. Even right now, with me just changing my lifestyle, with me just changing my complete lifestyle, and me gardening. When I first started gardening 4 years ago, I was called old lady. You doing old lady stuff. Why you doing my so-called friends? Now, to this day, how can my bell peppers grow? How can I get my tomatoes to do this? How can I fertilize? What fertilizer you use? And I don't mind. I'm not a gatekeeper, so of course I tell them. But it's just that you either going to walk this journey with me or you're going to get left behind, because there's going to be a gap, and I'm not going backwards to close that gap. You're going to have to meet me up here. You see what I'm saying? You're going to have to meet me where I'm at, because I'm not going backwards to close no gap. So if you feel a wedge starting to happen between us, then you meet me where I am, or I loved you. The time was fun. Great memories. You see what I mean? And so we gotta understand that, yeah, because you know why? Somebody said, I'm walk with you, I like you. And because you know what it is? It's like I always been a person that danced my own beats, and I always went against the grain, and then I was always criticized for it at first initially, but then the world catches up to me and they go, okay, I get it now. So that's why I never shut anybody out. I'm just not going back, nor am I waiting on you. Now, when you're ready to catch up, I'll be here to help you, but I'm not going back. You see what I'm saying? And so I don't leave anybody. I'll leave you behind, but I don't leave you behind to the point where I can't pull you up when you're ready. You'll catch up. So I got called old lady when I started gardening. I got called a nerd in the lane when I started nursing school. Like, they was partying in the club at 20 and 21. I was in my books. Now I'm the most financially stable. I'm the most everything, and they catching up to me. And I don't mind. Hey, here's some nursing stuff. Here's some medical stuff. I'm still going to help them, but I wasn't going to stop because you don't understand my vision and you don't understand my mission. That's between me and God. I know where he's taking me, and I know what he's doing. And when you're ready, I will be right there with open arms to help you, but I'm not going to stop because of you or your criticism. You see what I mean? So that has always been me all my life. All my life. You see what I'm saying? Somebody said, what are you studying for? No, I'm not in school anymore. I have my 3 degrees. I've been in the medical field for over 15 years. I'm talking about years ago when we was 19 and 20. And then they were, you know how that goes. And then when you get 22, 23, they still talking about you. And now I'm gardening. And, the first 4 years ago in 2020, when a pandemic happened, I started gardening because I see how the world was going. I saw how the world was going, and I saw the inflection of prices going up. I just saw it all before it happened. And I was like, oh. Well, I started out of high school. Started out of high school. And so it's like, what was I gonna say? I was getting somewhere. I done lost my train of thought. But as I grew a lot older, as I grew and as I continued to walk on my journey and in my path, those who were in my circle, they caught up to me, and those who are out of my circle, I just still pray for them and wish them the best. You see what I'm saying? So I didn't mean to get all off topic, but I just wanted to get on here and be transparent, because at the end of the day, we are in control of our own lives. We are in control of our own lives here. You see what I'm saying? And we got to learn to start taking accountability. Nothing is nobody's fault. Nothing is nobody's fault. How our life turned out is nobody's fault but ours. You see what I'm saying? So if we get hypertension, if we get diabetes, if we get, like the beautiful sister who was very transparent, who I really appreciate you. You my type of girl. How she said she has a polycystic ovarian syndrome, and she said, everything you named, I did it to myself. And the thing is, that's okay for you to admit that. And now you're getting this education that I'm giving you. So now apply it to your life so you can better your life. You see what I'm saying? Apply it to your life so you can better your life. So the more we know, the more we grow. And if you look at any of my labs on my other YouTube channel, YouTube is Higher Levels with Shay, Higher Levels with Shay. If you watch my other videos that I've done, I say this part a lot. If you take advantage of the knowledge, you don't leave room for people to take advantage of you. Period. And when I go to the doctor, I don't even tell them I'm in the medical field. I don't. I like to see what they do first. And then I talk to them and I ask them a slew of questions. And then just by my questions, they will sit there and say, are you in the medical field? And I say, no, I'm just well-knowledged. No, I'm just educated on myself. Oh, okay. Then their tone changes. Their tone changes. They start to be a little bit more respectful. They're a lot more patient. They're now taking their time because they know that you know what you're talking about. So when I'm giving y'all this knowledge, you don't have to go to school for this to be able to arm yourself with knowledge and know how to take care of yourself, know how to be a patient advocate for yourself. When you go into these physicians' offices and you're going to your wellness checkups, arm yourself with the knowledge. You see what I'm saying? If you go to them and they say you are pre-hypertensive, or you are pre-diabetic, or you're on a risk of being infertile, schedule your next appointment. Ask them all the questions you need to ask them. Because what I will say is this. You have to first of all ask them every question that you've had. Be honest about your symptoms and whatever you're going through. Be very, very honest about it so they can know how to help you. And be your own advocate. And the reason why I say that is this, because they're supposed to be in that office with you for at least an hour, not 15 minutes, not 10 minutes. Okay? So be your own advocate. If you leave out of there with more questions, let's say you pre-hypertensive or pre-diabetic, go home, do thorough research on whatever disease process. So when you have the next visit, you are more informed than you previously were. And then look into a holistic specialist and get a second opinion on how to help yourself naturally and holistically first. Okay? All right, y'all. So let's get into